Okay, so now I'm going to talk a little bit about genetics, epigenetics, and how this all comes into play, especially when we are trying to lose weight. Because as you can imagine, not many people are talking about genetics. We've started talking about, we talk about a lot of foundational issues, but there's so much coming out and there's so much more that we know now about this. So it's very exciting stuff. So just some quick definitions. Genetics, so your genes that you are born with will not change in your lifetime. So if you did a genetic test today, you do not need to do another one ever again because your genes are your genes. Nutrigenetics are essentially how you respond to certain nutrients. Nutrigenomics is kind of like the big area that research is digging into. So this is how your genes are expressed based on nutrients. And then epigenetics is how your I know this is probably a little much, but how your behaviors and your environment changes the expression of your genes. So what I mean by that is genes are like an on-off switch. I may have the gene for colon cancer or for some other type of disease, but if I live a healthy life and I do the right things, that gene may never be expressed. So that's what's very important to understand. And that's why when we are looking at genetics, this is not to find out that you're doomed. This is so we can change your path and manipulate your lifestyle so that you don't, you can overcome certain issues. 184 to 1,840 generations of natural selection. It will take 184 to 1,840 generations of natural selections to undergo meaningful genetic change. So that probably doesn't mean much to you, but if you think about this, our environment, the world that we live in has changed so much in the past 30, 40, 50 years. Our evolutionary genes were designed to do certain things, and now they're trying to adapt to really a corrupt modern world that we live in. So that's why people are getting sicker, and I'll kind of talk more about that. So I am going to introduce you to Anita, and this is actually an actual patient, but this will help you understand how genetics play such a big role in not only weight management, but nutrient utilization, the ability for our body to detoxify, etc. So this is Anita, but this is definitely a very common scenario that we see. So she's 85, she's single, an attorney. She came in and wanted to do the genetic test because she's been struggling with her weight. She has very low energy, joint pain, insomnia, and sweet cravings. Her medical history said that she's always struggled with her weight. She's tried every diet that does not work. She has joint pain. She's had an operation on her ankle, has a history of PMS, and is on contraceptives, and has not had any pregnancies. So her lifestyle is, she has a very stressful job. So obviously a lot of stress in her life. She works long hours, has limited sleep, and loves to socialize and be active on weekends. Her diet, so she tries to eat fruits and vegetables and relies heavily on quick convenience foods. So pasta, stew, fried food, etc. Snacks on high calorie food when stressed. Drinks 4 to 5 cups of coffee per day because she's tired, and enjoys wine and is a social smoker. Her exercise regimen, and she runs 2 miles or hikes on the weekend. So medications or supplements, she's on oral contraceptives. She takes a multivitamin, omega-3 fish oil, and anti-inflammatories for her joint when needed. Her family history, her mother had osteoarthritis, her father has type 2 diabetes, her brother's obese, and her sister has chronic fatigue syndrome. So that gives you an idea of Anita. And so some of the key things that we were kind of pulled out from her initial intake was that weight has been an ongoing issue for a long time. You know, again, given that, you know, we don't really know how hard she tried, you know, because it's, you know, she did say that she has a history of being stressed and eating poorly, but she really has tried specific diets and it really did not work for her. Has a busy lifestyle and a highly stressful work and has several injuries. So she's very prone to injuries. Okay, so this is a very busy slide. I know you probably can't read a lot of it, but we're going to dig into the specific areas. So essentially, we're looking at different pathways that are negatively affected by your genetics. So anything that's highlighted in purple or dark purple means that there has been a pathway that's genetically, you know, has disrupted that pathway. So if you look to the right, you can see that she has an issue with her glucose and insulin management, mood and behavior, her ability to balance hormones, and she also has collagen and joint issues as well. So that is what her genetics and those inflammatory pathways are telling us. And I am going to dig into this in a little more detail. This is now looking at her energy balance. So for Anita, all of her energy pathways were affected. So really what that means is when we're talking about energy balance in the body, it means that you really are having a hard time balancing the way you store energy and the way that you burn energy. So you can see to the left, the first one, appetite satiety. We experience appetite, hunger, and fullness very, very differently. And we hear this all the time. So, you know, this is where we learn a lot by these tests too, because sometimes we just assume people are hungry because they're not following the diet, or maybe they're doing something that's outside of what we had recommended. But genetically, there could just be a reason for that. This is another big piece, pro-inflammatory fat. So this pathway was affected, and this essentially means that her fat cells are prone to inflammation. When her fat cells are prone to inflammation, it is very hard to release them and to be used for energy. So that, again, there's certain things, you know, at the end, I'll bring it all together, but these are very important pieces to the whole puzzle. Energy balance, again, we know she has a problem with balancing energy. So that tells us that her metabolism is not great. Exercise response is high. So she had, basically what this is telling us is that Anita is not going to do great with utilizing exercise for weight loss because her exercise response has been affected. So we still always want people to exercise. She's going to benefit more in the glucose management, the insulin management, the brain health with exercise. But this test is telling us that for weight loss, we're not going to push Anita to really just exercise too much. And then the last piece is weight gain and weight loss resistance. So we know that she just overall genetically is going to have a tougher time losing weight. So that's why we have to adjust accordingly. And then again, this is just looking at her activity. Our genetics will tell us, how should you be exercising? You know, should you be doing high intensity, or is that too much stress on the body? And also a big piece is recovery. Some of us need longer recovery periods. Some of us don't. And for Anita's case, her genetics showed us that she needs recovery when she exercises because, you know, obviously she was more prone to injury, as you recall from her initial intake. Okay, and then there is digging into all of the different nutrients. So this is the nutrigenetics, how our body responds to certain foods and nutrients. So caffeine is a big one. And, you know, again, I think about my sister all the time because whenever she has caffeine, it makes her shake. She just is so sensitive to it, where I do fine with caffeine. And so everybody metabolizes caffeine very differently. So Anita just happens to be a very slow or poor metabolizer of caffeine. So obviously we're going to tweak things because of that. Fatty acids, she does not metabolize fatty acids very well. There are specific nutrients that she is not utilizing or manufacturing, such as the choline, folate, which are so crucial to not only detoxification, but metabolism as well. So you can see here some other nutrients that we can identify, which is, you know, iron overload, gluten, vitamin D, salt, vitamin C, and vitamin B12. She just happened to have those four that I pointed out. But by knowing these things, it can really be a game changer for a lot of people. Okay, so for Anita, you know, what is Anita's priority health goals? Obviously, weight loss. A big one was her lack of energy, and the third was improving her joint health because she was in a lot of pain. The three metabolic pathways that we need to address first were the inflammation, the detoxification, and the collagen and joint health. So this just gives you an idea of how we can be very strategic and we can personalize her plan. So including foods that supply nutrients for phase 1 and phase 2 liver detoxification. This is so important. And we kind of throw around detoxification a lot, but we really dig into this because it does play a huge role in so many aspects, especially weight loss. Really getting her to eat more foods that modulate inflammation. So polyphenols, blueberries, dark chocolate, olives, nuts, and ensuring adequate intake of proteins, protein, vitamins, minerals, and really supporting the glucose and insulin pathways, because that is essentially what is going to help her start getting the weight off. 3 lifestyle recommendations were to practice exercises that increase the range of motion, improve strength, endurance, and balance, and work up to high intensity gradually rather than kind of going at it hardcore. Avoiding harmful microplastics, non-organic personal care. This is such an important piece, and I think to everyone's health. But when you don't detoxify well, you would know that. I mean, you probably have not thought through, but if you're someone who doesn't, you know, is very sensitive to like a lot of perfumes or candles or air fresheners, things like that, that just means you're toxic overloaded, or you're not a good detoxifier. You can't get that out. Your body can't metabolize it quick enough. So you're kind of overloaded. So obviously there's so many different lifestyle changes that you can make to address that. And then addressing sleep hygiene and exposure to or early morning light exposure to support her cortisol balance and hormone balance and things like that. Supplements, the targeted supplement recommendations were sulforaphane. This is along with the vitamin Bs, magnesium, selenium. So again, for her, these are ideal. She also had recommendations for the inflammation aspect of her pathways. So curcumin, boswellia, quercetin, there's so many that are so effective for inflammation. And then hydrolyzed collagen for connective tissue, as well as other minerals. So Anita had very good progress. Finally, she lost more than 20 kilograms over 6 months of treatment. And, you know, you can imagine that when somebody is finally able to gain ground and really understand how they can align with their genetics, it can be very, very motivating. So she reported experienced improvements in her mood, sleep, and energy levels, and she definitely does regular detox programs 3 to 4 times a year. And I am typically telling people that probably everyone needs to do this, even if you are a poor detoxifier, because again, we don't live in a world that we lived in 20 or 30 years ago. We are exposed on a regular basis. So the key learnings was to really understand why Anita battled with her weight. We really looked at the root cause and we focused on the main pathways that were essentially disrupted. Okay, so now I want to kind of bring some things together with the programs that we offer and the program that I'm going to talk to you guys about at the end of the presentation. But a big piece to weight loss is being able to mobilize the stored inflammatory fat. And so with our programs, we're able to do that regardless of your genetics. We see it over and over again. Our programs target these resistant fat cells. So you can see the image to the right. The subcutaneous fat is the outer layer fat cells. The visceral fat, as you can see, is that deeper inflammatory fat that is very difficult to lose. So you do just lowering your calories and going on like a lower calorie diet, you won't touch the visceral fat. So that's why you have to be strategic. And essentially, when you complete one of our programs, your metabolism is better. You're just metabolically in a healthier state because all you're losing is fat and you're maintaining your muscle mass. So that's why maintenance is much easier when you start out with these more aggressive strategic programs. So again, I think it's very, very important to understand the differences in fat. There are different fat stores in our body, and fat is way beyond just not looking great from the outside or not feeling good. You know, having too much fat or being obese is the beginning of all different diseases. It is, I mean, there's so many complications that we all know this, but I often do think that there is a large number of people that develop diseases and they think it is just a disease that they've developed because that's just what they were given. But trust me, it usually starts with that foundation early on, inflammation, and then it's resulted in something worse. So really, what is the roadmap to a healthy body and a healthy weight? Knowing your genetics. I mean, that to me makes a whole lot of sense. Understanding your gut and personalizing a plan. Personalizing health and nutrition is the future. It is the future. We're starting to recognize that, you know, all of these the programs that address, or I'm trying to think of it. One program that fits all people is just does not work. You know, it works maybe for a very short period of time and then it stops. So you have to personalize it. You have to personalize your exercise regimen. If you're exercising too much, that might be an added stress on your body. So knowing how you can adapt to that. Mindfulness and meditation has to be a part of your life. It just has to be. And you can fit that in how it best fits with you, but I am telling you, it's so important. Knowing the right supplements to supplement with and also being able to understand what your detox pathways look like and detoxing on a regular basis.